Only when I'm already mad at you for not reading my mind.
It's true. What's up, guys? I'm David Hinden, and if you're new to this channel, I'm a trauma surgeon, and I usually make videos about technology and history in medicine. But today, we're going to react to some videos by the hilarious Dr. Glaucom Flecken. So I downloaded a bunch to my phone. I haven't actually watched them yet, so you and I are going to take a look together. Let's go. First of all, there are so many jokes about medical students cutting suture because honestly, you can never win when you're in med school. You cut it, the surgeon wants it longer, then you cut it longer the next time and it's too long and they want it shorter. It feels like you can never win. There is definitely a science that goes into how long you want your tails to be on suture that you cut, but that's for another time. The joke here is that this poor medical student, instead of cutting the tail of the suture, cut the knot itself, which means that whatever vessel it's tying down is now going to flop open and possibly start bleeding. Things you don't say during surgery.
Oops.
Yes, oops is a no-no.
Oh, stranger.
So there's a lot of great stuff about this. One, learn the anesthesiologist's name. Like if you are the resident or the med student, learn what their doctor name is, Dr. So-and-so. And if you're an attending, hopefully most attendings know the anesthesiologist by their first name or their, Dr. So-and-so name. Don't just call someone anesthesia. Oh, and one other thing I love about this is the whole patients moving. Like you just tell anesthesia, patients moving, and then it's their problem to paralyze the patient or get the patient to stop moving, but it's a little bit more complicated than that. We'll talk about that later. Okay, let's get another. I'm just going to tell you, this is probably a nurse either talking to a med student or like a super junior intern resident or someone that's not familiar with the OR, but yeah, this is good advice the first time you're in the OR. Like, if you don't know what you're doing, even if you do know what you're doing, if you are not personally sterile, you shouldn't touch anything that's blue because that is sterile. Let's keep watching. Poor med student. Oh no. So the joke here is that when you are unwrapping something and the contents are sterile, there's a way that you have to unwrap it so that you don't touch the sterile contents with your non-sterile self. So it's kind of like peeling a banana almost, like you kind of unwrap it from the outsides and you're pushing up the inside, and then you can hand that sterile insides to the sterile tech or anyone else that's sterile. But the joke here is that this poor student has now touched the sterile stuff with his grimy, non-sterile hands and is probably about to hand it to the scrub tech and contaminate the scrub tech. This still gives me stress just watching, even though it's a total spoof, but let's keep going. So, because this poor student has thrown now a non-sterile set of gloves on top of a table in which everything was sterile, they have contaminated the entire table. And yes, I did this once in the very, very beginning of medical school when I was shadowing in the OR and didn't realize what the scrub tech meant by toss your gloves up. So I'll never forget, and I can totally empathize with the med student Glaucom Flecken in this video. Oh God. And of course the surgeon's got to look up and shake their head. I love that the intubated patient is somehow awake enough to disapprove and shake their head. Ugh, this is great. Okay, let's keep going.
Oh, you must be our new med student. What specialty do you want to go into? Well, I'm actually thinking about surgery. Well, you should know surgical residency is extremely difficult, so if you want to have an easy time, go down the hall of pediatrics. I'm sorry, what was that? Oh, nothing. Oh, well, I think you just said pediatric residency is easy. Well, is it easy when your patients have completely different physiology that changes rapidly as they age? Well, no. Oh, maybe it's easy to code a newborn or tell a child they have cancer. Or maybe...
I'm starting to laugh. The cancer thing isn't funny, though. It's true.
Maybe you think it's easy to treat kids whose parents range from attentive to neglectful to downright abusive. No. You think it's easy to do all those things while working in a healthcare system that values an appendectomy more than treating a teenager with depression? No, I'm just... Our patients are really complicated. Oh, that must be why your consult notes are so long, right?
Oh, gosh.
Here, have a sucker. Thanks. It'll take your mind off those severe burns.
Okay, this was really not funny. It was just sort of salty and sad because it's true.
Okay, where is our med student? I'm right here. I want you to hold this retractor.
Oh, gosh. That's a poor med student. Okay, there's a lot to unpack here. 95% of a medical student's life in the operating room is holding a retractor and retracting the wound. Maybe the rest of the 5% are suctioning smoke, and as you get a little bit more senior in medical school, or even just you've been on the rotation longer and they get to know you and they've been doing some teaching, you get to do a little bit of sewing and suturing. But so much of this is holding retractors, and there's a real skill that it takes to retract properly. It's not just holding and applying a lot of tension, which is a huge part of it, but it's starting to get a sense of where the surgeon is going next, so you can shift down on one retractor and retract more with your other hand and sort of change the exposure in a way that the surgeon is getting to see exactly what they need to see as they're moving. But it takes a long time to learn that, and so it's so painful in med school having to learn for the first time. My heart goes out to this poor med student.
Have you ever used one of these before?
Oh, God.
Okay, I want you to be firm but gentle. Hold it where I place it, but also move it where I want you to move it.
Yeah.
Will you tell me when you want me to move it? Only when I'm already mad at you for not reading my mind.
It's true.
So place the retractor right here and don't move it. Okay. And we are all done. I'll take the retractor now.
It's true. Surgery is very much a full contact sport, and it can be exhausting. And the poor medical student often, unfortunately, people in the room might not be thinking of. So you really have to be proactive in asking a med student if they're getting tired or if they need a break, because if you don't, oftentimes a med student will sort of feel too timid to speak up and will be really exhausted. Hopefully they won't collapse like this one, but it can be exhausting.
Nurse, can we get a new med student, please? Thank you.
All right. Want to see more reaction videos? Let me know in the comments below. I'll see you soon.